If you're nearing the end of your pregnancy and you're wanting to help your baby engage or enter into your pelvis, in this video, I'm going to break down 6 exercises that you can do during your pregnancy to help support your baby entering or engaging into your pelvis. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula. And in this video, I'm going to break down different movements that you can do to help support your baby's engagement or entrance into your pelvis, either during pregnancy or during labor. Before we dive into what exercises that we can do to help your baby engage, I want to put on a disclaimer that it is okay if your baby has not engaged before labor begins. Engagement does not equal labor onset or the start of labor. You can be pregnant and your baby can be super engaged for weeks, or they can be floating around and you can be in labor. So engagement does not equal labor onset, but it is an important part of your baby's path through your pelvis. So during pregnancy, we can do exercises to help support our baby's position and create more space in the top of the pelvis to make it easier when labor does begin. When it comes to helping our baby enter or engage into the pelvis, there's a few different things that we want to think about. One, we want to ensure that our baby's head is properly aligned to the pelvic inlet or the very top of our pelvis. And so if we think about our baby like a square peg and our pelvis like a square hole, they're meant to fit together. But if baby is aligned like a diamond, they're going to have a hard time fitting into our square hole. And so we first want to think about how can we support our baby's position by releasing tension in the surrounding musculature. There's different muscles that surround your uterus. There's different ligaments that attach your uterus to your pelvis. And if there are restrictions or obstacles in your baby's path to rotate, it could make it a little bit harder for them to align and engage into the pelvis. So we're going to discuss some exercises that help to release that uneven tension to help improve the positioning of the pelvis and the ribcage to better align baby to the pelvis. I'm also going to break down some exercises that help to create more space within the pelvis. During pregnancy, we tend to favor a more extended spine position where we are arching in our back a lot more and more external hip rotation, so toes pointed outwards. Because of these common postural tendencies, they tend to compress space to the back part of your pelvis, and so the back half of your pelvis actually has less space. And because of that, it can actually push your baby forward over the pubic bone. So the compression in the back part of the pelvis can push baby forward to where they have a harder time entering into the pelvis. So even though our square peg is aligned to the square hole, if it's shifted just a little bit forward, we're still going to have a hard time for it to enter into the pelvis. And then the third thing that we're going to incorporate is rib cage mobility. Your rib cage influences how your pelvis can position itself. So if I have a more extended spine position where my rib cage is thrusted upward, the pelvis tends to respond by also arching and tilting forward as well, which can make it harder for your baby to enter into your pelvis. In addition, you could also have more of a twist in your upper body where we're compressed more to the right side, which is going to cause a twist within the pelvis as well. And so we tend to have a response in our pelvis in regards to what's happening within the rib cage. And so if we want to support our baby's ability to engage or enter into the pelvis, we need to think about what is their position and can we support their rotation by releasing tension? Can we increase space within the top part of the pelvis by improving pelvic mobility? And can we think about the rib cage to help support our pelvic position? And the good news is all of the exercises that I'm going to break down in this video are already incorporated within our prenatal fitness programs and our birth prep programs because we want you to feel good within your body during pregnancy, in addition to help support your baby's position and create more space within your pelvis as you prepare for birth. And so you can check out all of our prenatal fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. So now let's break down 6 exercises that you can do to help your baby enter or engage into your pelvis. The first exercise that we're going to do is going to be focusing on creating more space in the back side of the body that tends to get very compressed during pregnancy. And so we're going to start with some back expansion breathing exercises. So you're going to take a block and place it between your thighs, and then you're going to slightly point your toes a little bit more inward. What this is doing is increasing your inner thigh activation and kind of forcing your hips and pelvis into a more internally rotated position to help create more space in the back part of your pelvis. Then I'm going to hold on to something. I've got a chair here, but you can use like the back of your couch, a table, something that's not going to move as you shift your weight back just a little bit. So from here, I'm just going to kind of sit back into a slight mini squat. I'm squeezing that block, and then I'm just going to tuck my pelvis underneath to find a little bit more rounding in my back. I'm going to take a big inhale to breathe into the backside of my body, and then exhale, pull belly to spine, which is going to help you to find more of a rounded position. So big inhale into your back, and then exhale, pull belly to spine. You can also do this from a tabletop position. So we still have that block between our thighs. We're going to slightly bring the feet out a little bit wider for a little bit more internal hip rotation. And then from here, I'm going to push through my hands to round in my back, or you can come down to your forearms to round in your back as well. And then same thing, I'm going to breathe into the backside of my body, and then exhale, pull belly to spine. In both of the movements, you should be feeling more of a stretch in the lower back area and releasing tension here. And so you can breathe here for 1 to 2 minutes or as long as it feels comfortable for you. After that, we can move into a hip flexor release or a psoas release to help improve your ability to tuck your pelvis underneath. And this can also target the round ligaments, which are the vertical running ligaments on your uterus. Next, we can move into a half kneeling lunge position to release the psoas muscle or the hip flexor. When we have really tight hip flexors, it kind of pulls us into a more extended spine position. And so releasing them can allow you to find more of a rounded position to help support your baby being able to drop into your pelvis. In addition, hip flexor releases tend to also target the round ligaments, which are the vertical running ligaments on your uterus. If these ligaments are really tight, it can make it harder for your baby to rotate through your pelvis to find their best position to be able to drop in as well. In the half lunge position, you're going to tuck your butt underneath and then push your hips forward. And then you're going to reach overhead with that same side arm and then lean away for a side body release. So we have this kind of full side body into the hip flexor release happening here. I like to breathe here for about 10 breaths or a minute, and then you can switch sides. And just pay attention to what side may feel a little bit tighter versus the other. Next, we can do some one-sided releases. Because our pelvis tends to have a little bit of a torque within it, with the right hip sitting a little bit more back and the left hip sitting a little bit more forward, we can do some asymmetrical releases to help improve that pelvic mobility. So in this position, I'm going to find an open lunge. So my knee is moving away from my pelvis. I'm going to to rotate my belly away from that thigh. So you're going to feel more of a groin and inner thigh stretch here. For the right leg, I'm going to find this open hip position and then drive into that knee while keeping the big toe down. And when I do that, I'm going to feel more of a stretch in that groin and inner thigh. And you can just rock back and forth here for about a minute or do about 10 rocks. While you do this, you can also add in a weight to move a little bit deeper into it. I like to press against my inner thigh of that right leg to really emphasize that open hip position, but really focus on keeping that big toe down for more of a release on that right side. If we want to add in more of a release to the left side, we can also incorporate a lateral hip shift. In the lateral hip shift, feet are going to be a little bit wider than hip distance, and your feet are going to be parallel towards one another. Throughout the duration of this movement, I'm going to think about lots of weight in my big toe. From here, I'm then going to hinge backwards in my hips, so my torso is about a 45-degree angle, and my hips are going to come back just a little bit. And then I'm going to shift my weight over to the left side. So you can see that my left knee moves forward a little bit as my hip moves back. As I shift to that left side, my belly is rotating towards that thigh. So if I had both my hands on my hip, they're not just staying parallel towards one another. That hand is going to be moving closer to my left foot, and that right hand is going to be moving lower than the left hand. So you can see that there's this twist in my body. From here, I'm going to think about keeping weight in both big toes. I'm going to feel more of a stretch in kind of the hip pocket area of my left glute. This is going to be releasing tension in the back half of my pelvic floor. And then I'm also going to be feeling more of a release in this right inner thigh and groin area. So kind of enhancing what I felt in that half lunge position. From here, I can just hold this position and reach for that left foot for a little bit of thoracic mobility, so rotation. And then when you feel good, you can begin to alternate from side to side, adding in the reach and the rotation. So we have thoracic mobility, incorporating it with pelvic mobility. So I'm finding an open to a closed hip position. And then similar to the half lunge, you can add in a weight to really emphasize the rotation as well. The weight is just going to bring you a little bit deeper with the thoracic rotation and shift you a little bit harder into that hip. Continuing with the asymmetrical positions, I'm going to come down to the floor for a 90-90 position to emphasize external hip rotation on the right and internal hip rotation on the left. So again, our pelvis is not perfectly symmetrical. The left hip tends to sit more backwards as the right hip tends to sit more forward. And so we tend to emphasize more of an internally rotated position on the right and externally rotated position on the left. And so this setup is bringing us into the opposite for more of a release. From here, I'm going to place my hand down onto the floor, my right hand, and then I'm going to allow my right side body to kind of fall to the floor for more of a stretch through this side body. So for a lot of us, the right side body tends to be a little bit more compressed compared to the left. And so really emphasize right side body opening can help to support your baby's position as well. So from here, I'm going to breathe into the ribs on the bottom part here, almost like I'm trying to pull them apart from one another. And then exhale, kind of compress a little bit more on the left side. So big inhale into the right. And then exhale, crunch a little bit more to the left. And then you can breathe here for a minute or two. You can also bring the legs together to really get a little bit deeper into this position. But if you want more of the hip release as well, we're going to have this 90-90 position. After we've come into this side body position, we can move into a 90-90 side camel. So we're going to reach overhead to find that side body opener on the right. So again, that lateral thoracic mobility. And then I'm going to place my hand down on the floor, extending the hips to feel a hip flexor release on that back leg. And you can reach overhead here. So we have our thoracic mobility with our asymmetrical hip position. And then we have our hip flexor release with some more side body opening as well. So we're kind of incorporating a lot of really good stuff to help release tension and create more space within our pelvis to help support our baby's position and engagement for birth. So a lot of these exercises may have been non-traditional engagement exercises from what you're used to. You may have been told to do a lot of squats, lots of wide leg positions to help your baby drop into the pelvis. But we need to think beyond that. We need to, one, support our baby's rotation so they can better align to the pelvis. So again, we got our square peg and our square hole, and we want them to be aligned so they fit more easily. In order to do that, we need to release tension in the musculature that surrounds our pelvis. So releasing the round ligaments of the uterus, the broad ligaments of the uterus, uterosacral ligaments, in addition to the abdominal wall and the backside of our body. We also need to incorporate rib cage mobility because our rib cage position influences how our pelvis is going to position. And if our pelvis is not quite aligned, it's going to make it harder for baby to enter into the pelvis. So you can do all of these exercises to help improve rib cage mobility, improve your pelvic mobility, and to help support your baby's position so they can more easily engage when labor begins. If you want more exercises to help support you throughout your pregnancy and help you prepare for birth, check out our online prenatal fitness programs. We incorporate daily workouts to keep you strong, pain-free, and help you prepare for birth. You can check out all of our fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. And be sure to subscribe to our channel because every Tuesday we release new videos like this where we either walk you through an entire workout or we break down exercises that you can do to help support a more comfortable experience.